Good morning. Welcome to our session. Today we'll be discussing the most probable question from the second chapter of zoology part of second year topic, namely human reproductive health. We have studied human reproductive system in the previous day. Today we'll be discussing the question from reproductive health. Okay, so all aspects from reproductive health, which is of more practical use in our daily life. First question: feature of an ideal contraceptive. What is a contraceptive? Anything, any measure or a device that is preventing conceiving, preventing a mother becoming pregnant. That's called contraceptive. Contra means against conceiving. Okay, it is called contraceptive. There are a lot of contraceptive devices available in the market, and a good contraceptive will be accepted only if it is user friendly. It should not interfere with the normal sexual life, and the user can use it without the help of anybody else. It should be user friendly. It should be easily available. Everywhere it should be available. It should be very, very effective. Then only people will be accepting it. It should be very effective. It should be reversible. That is, if a couple want to have a child after some time, they should abandon this mechanism and they should become conceived. The mother should be capable of conceiving. They should come back to the normal. That's what's called reversibility. It is not reversible. It should be reversible. So it is not a good character. It should not interfere with the sexual act of a user, either with the desire or sexual act. It should not interfere. If it is interfering with the normal sexual life, people will not accept it. So, you should be having a mechanism that should not interfere with the normal sexual life or sexual desire of an individual. So, only 1, 2, and 3 are correct. Incorrect statement. See, periodic abstinence is a natural mechanism. Natural mechanisms are working on the principle of avoiding the chance of meeting of gametes. We are not allowing the gametes to meet together. Naturally, we are avoiding that chance. How? We know that it is on the 14th day that ovulation is occurring, and ovum will be remaining live for about 2 to 3 days. Similarly, sperms may be also living for 2 to 3 days. There may be some minor changes. Sometimes it may be occurring 1 day earlier or 2 days earlier or 1 or 2 days later. So, generally we say that it is from day 10 to day 17. This is the 14th day. So, we give a allowance of 3 days. So, from day 10 to day 17, there is more chance of fertilization because an ovum is present. Fertilization will be occurring only if ovum is present along with a sperm in the female genital tract. So if coitus occur on such days, mating occur on such days, the chance of fertilization will be very high. That's why these days, day 10 to 17 are called risky days or red days. Danger period. Okay, 1 to 5 days, that is menstrual day, and there will be no much harm if sexual mating is occurring in days 6 to 10 and 18 to 28. That is comparatively safe. That is why this period is called safe period method. Calendar method, natural planning, etc., etc. Safe period method. So, in periodic abstinence, we should not enter into the couple should not enter into the sexual act on day 10 to 17 of the menstrual cycle. Okay. So, in periodic abstinence, couple avoid or abstain from coitus from day 10 to 17. Correct. Day 10 to 17 on the menstrual cycle is called safe period. No, it is called red days. Danger. That is more chance of fertilization on such days. So, this is wrong. Lactational amenorrhea. As long as the mother is intensely lactating, that milk is producing or milk is containing an inhibiting factor, reported to be very effective only up to a maximum period of 6 months. Correct? Because the amount of milk decreases. Okay. So, that suppressive effect is not that effective after, say, 6 months. Natural method work on the principle of avoiding chances. Correct? So, only 2 is wrong. So, it is E. This is the calendar method, which is also called natural family planning or safe period method, etc. Wrong statements. Diaphragm, cervical caps and walls are also barriers. Barriers are anything that will be physically preventing the meeting of gametes. That is the working principle. These are all used by female. They are all inserted into the vagina so that sperm cannot enter. They act as barrier. Correct. Diaphragm made of rubber that are all inserted into the female reproductive tract to cover the uterus. No, these are all inserted. See, this is the cervix. What is cervix? The narrow part. Okay. And the cervical caps, walls, etc. They are all made up of rubber. Only there is difference in their shape, size, etc. Cap, walls are all barriers which are all inserted into the vagina. Here, sperms are released and we are keeping that barrier here so that they cannot enter into the cervix. This is the uterus. Okay. It is used to cover the cervix. Cervix is covered, not uterus. Diaphragm, cervical caps and walls are not reusable. No, they are all reusable. They can be taken out, washed and again inserted because they are all thick, made up of rubber. Spermicidal creams, jellies and forms are usually used along with barriers. Correct? We can also use it. Jellies, creams or tablets can be formed, tablets can be inserted in the vagina so that will be effectively increasing the effectiveness of such barriers. Okay, that also is correct. So, only 2 and 3 are wrong. That is why we go to option B. Now, this is not in our NCERT books. Chlamydia trachomatis. Okay, we are having chlamydiasis, that is caused chlamydia trachomatis. Chlamydiasis, chlamydia trachomatis. Chlamydiasis is the disease. Okay. Gonorrhea. Gonorrhea is caused by Neisseria gonorrhea bacterium. Trichomoniasis. Trichomonas vaginalis is a protozoan, flagellated protozoan. Okay. It is Trichomonas vaginalis. Syphilis, caused by, this syphilis is a bacterial disease caused by Treponema pallidum. Chancroid, that word is again not in our NCERT book. It is caused by Haemophilus ducreyi bacterium, which is very common. And genital warts, the virus. Genital warts is caused by human papilloma viruses. Okay. So the option is box. So we have to study the causative agent. It may be a bacteria, it may be a virus, it may be a protozoan or even a fungus. Among different ARTs, artificial reproductive technique, dash is useful for women who cannot produce an ovum. She is not at all producing an ovum, but can conceive. Her uterus is normal, healthy. So, he cannot produce an ovum means she has to get an ovum from outside. A gamete is to be transferred into her body. It is gift. So, gamete intrafallopian transfer. Okay. She cannot produce a gamete. So, there is no point in waiting. She cannot produce an ovum. So, ovum is to be then gift. Dash is useful for women who can produce an ovum. These are the two common causes of infertility because of a defect in female. She can produce an ova but cannot conceive. So what should be done? Either take her ova or after fertilization her zygote. Okay, it is better to take a ova. Have fertilization done in laboratory condition, in vitro fertilization, and transfer that embryo to a surrogated mother because she cannot conceive. That is why we have to donate or transfer it to a surrogated mother. So, in vivo fertilization, that's easy. Okay. In her fallopian tube itself, naturally fertilization can occur. But immediately that embryo is to be retrieved, taken. Either her ova is to be taken or after fertilization. So, either in vitro or in vivo fertilization, but embryo is to be transferred because she cannot conceive. That is to be given to a surrogated mother. Regarding implants, this is an implant which is Norplant. We are having 6 celestial tubes, each having 6 milligram of levonorgestrel. So total, you will be having 36 milligram of levonorgestrel. They are all implanted just beneath the skin, just pushing beneath the skin using a small instrument. And the thing is that they are all at 15 degrees inclined to one another. Okay, so if the first one is in this, the last one should be in this direction. So each of them should be in this 15 degrees inclined together and should be implanted just beneath the skin in the upper arm, about 8 to 10 centimeter above the elbow in a female. They contain progesterone alone or in combination of estrogen, that is levonorgestrel. See, we don't use natural progesterone. Instead, we use artificially prepared synthetic progesterone. Why? Natural progesterone will be easily be metabolized. So its effect will not be there. That is why we are using artificially prepared chemicals which are equivalent to molecular analogues of this progesterone, that's levonorgestrel. Implants are kept under skin, correct? Mode of action is similar to that of the pills because they are having the same chemical, progesterone, that will be suppressing ovulation, that is the action. Mode of action is similar. Effective period of implant is shorter. No, it is longer. That is the advantage. See, in pills, the effectiveness will be only for those days on which you are all taking pills. And you have to take 21 pills continuously for 21 days. Thereafter, you have to stop. So, only during that time, you will be getting protection. Whereas, in implants, you will be getting protection for years together. So, once an implant is, this is a Norplant. If that Norplant is implanted in your body, you will be completely protected for about 5 years, long term. So, that is the wrong one. Okay. True or false? Abortion can occur, could happen spontaneously, naturally. It may be sometimes occurring even before completing the gestation period. Sometimes baby coming out. It is a natural. Infertility is defined as the inability to produce viable offspring and is always due to abnormality. No, it may be because of the defect of male or female partner. Both of them are. responsible for infertility. You cannot blame always a mother for not begetting a baby. Complete lactation could help a natural method of contraception, lactation amenorrhea. But remember, it should be complete lactation, full lactation. Mother should be always producing milk. The milk level will be declining as time passes on. That's why complete lactation, that word is used. Okay. So as long as the mother is fully lactating, there will be a natural method of suppressing of fertilization. Creating awareness about sex-related aspect is an effective method of improving reproductive. Yes, we have to educate people. People are ignorant of, they don't understand the importance of reproductive health. Okay, so only one is wrong, two is wrong, all of these are correct. That's why the option is apple. Then, methods of contraceptive mechanisms. Vasectomy. Ectomy means surgical cutting and removal. Here a part of the vas deferens, male duct. So it is in males, we are having males, vas deferens. So C and E, we are having three options. Immediately you can eliminate others. Tubectomy. It is for females where the fallopian tube that is cut, a small part is cut and tied. So it is female and oviduct. And what is oral pills? Oral pills are pills that are taken through the mouth. They are all containing either progesterone or progesterone-estrogen combination. A. And what is traditional? It is the coitus interruptus or withdrawal. Simply we can call it as withdrawal methods. The male is withdrawing his penis before ejaculation. It is also called onanism. This is the oldest method of contraception. Oldest method. People practice this method in time immemorial itself. Okay, it's called onanism. So, traditional birth control, that is coitus interruptus, also called withdrawal or onanism. Clear? Now, contraceptive measures and their correct method of action. In tubectomy, just I told you, duct is cut, temporal and tied so that it is blocking the transportation of gametes. It is not interfering in the formation of the gametes, but transportation of the gametes. So, tubectomy blocks gamete transportation, correct. Oral pill inhibits ovulation and implantation because it is containing hormone. That hormone will be preventing the release of gametes. That's correct. IUD, intrauterine devices. It is blocking sperm entry. See, there are three types of IUDs: non-medicated, medicated, and hormone. Their actions are all different. All of the IUDs are having increased phagocytosis. It's not blocking the sperm entry. It is increasing the phagocytosis, and their actions are slightly different from each other. Diaphragms. Diaphragms are barriers physically preventing increase the phagocytosis. No. So block this. These are all mutually interchanged. They are all wrong. So only A and B are correct. These are all the ARTs, assisted reproductive technologies, that a couple can accept for having a child. Okay, what is SIFT? Zygote. A fertilized zygote is transferred into the fallopian tube up to 8-cell stage. So that should be embryo transferred at 8 blastomere stage into the fallopian tube, correct? Whereas gift, gamete, an ovum is transferred. A mother cannot produce an ovum, so she should be supplemented with, she should be given a ovum from a donor. So, transfer of ovum into the fallopian tube of another female. Okay. ICSI, intracytoplasmic sperm injection. So, sperm of a male is directly injected into the ovum of a female because the sperm is having no motility. It cannot move and meet with the ovum. So it is directly injected. Okay, under microscopy, we are all watching and directly injecting it through a micro syringe or pipette. Artificial insemination, AI, when a male is completely impotent, he cannot produce any sperm. Sperms of a donor are artificially introduced in the uterus of a female. Okay. And what is IUT? Intrauterine transfer. Transfer of an embryo into the uterus. See, we can transfer the embryo either to the fallopian tube or to the embryo depending upon the stage of development of that embryo. If the embryo is up to 8 cell stage, it can be transferred directly into the fallopian tube. If it is after 8 cell stage, then it is transferred into the uterus. So, embryo transferred at 32 cell stage. Okay. Amniocentesis, old technique which is now banned. This is a technique for understanding whether the baby can have any chromosomal anomaly. It's a prenatal diagnostic method. Even before the delivery of a baby, whether this baby is having any abnormality on chromosomal nature, number, structure, etc. can be studied by karyotyping. That is what's meant by amniocentesis. But it is misused. People are misusing it. Why? They are all using for detecting the sex of the baby. And if they find that it's a baby girl, then they will be asking for an abortion. Female feticide. So people are abusing it. This is a abuse. What? Sexing and female feticide. Finding out the sex of the fetus and destroying it. Detecting the presence of proteins? No. Detect the chromosomal aberrations? So these are all the normal techniques that are the aim of amniocentesis. Gaining information regarding the health of the fetus, that is through karyotyping, all the above. But people are abusing it. They are all misusing this technique. That's why the government has banned it in finding out the sex of the fetus. These are all the aims of amniocentesis, whether the baby can have any chromosomal defect. Now, again, incorrect statement. Natural method work on the principle of avoiding the chance. We have studied it. That is the working principle. Each method is having its own working principle. Natural method is working on the principle of avoiding the chance. Periodic abstinence is a natural method in which couple avoid or abstain from coitus from day 10 to 17. That is correct. That is the red days, risky days. Correct. Day 10 to 17 is called safe period. No, it is not safe period. This is called the difficult times, red days, danger days. That's why couples should avoid sex on such days. Lactation amenorrhea has been reported to be very effective only to a period of 6 months. Side effects are almost nil natural. In natural method, the only plus point is that there is no side effect. And its negative point is that it is not that much effective because we are not using any techniques, very artificial methodologies. Side effects are nil. There is no side effect. That is the most advantage of natural method. True statement about barrier method of contraception. What is the principle of barrier method? Barrier acts as a barrier so that gametes are physically prevented from meeting. We are placing a barrier in between so that we are physically preventing the meeting of gametes. That is the working principle. In this method, ovum and sperms are prevented from physically meeting. That's the correct one. That is the correct principle. These methods are available for both males and females. Correct. We are having condoms. Condoms are for both males and females, whereas cervical caps, walls, etc. are only for females. Nirod is a popular brand. This one is the popular brand of Nirod, popular condom for males. Okay. Diaphragm, cervical caps and valves, they are all only for females. They are all to be inserted into the female reproductive tract, into the vagina. They are all to be inserted to cover the uterus. It is not uterus, it is cervix. During coitus, these prevent conception by blocking the sperms, but are not reusable. See, we can say that there are reusable cervical caps, walls are all reusable. Only condoms are non-reusable. Spermicidal creams, jellies and foams are usually used along to increase the efficiency. Correct. So we are having 2, that is 4 and 5. So 1, 2, 3, 6 are correct. 4 and 5 wrong. See, this is the male condom. Female condoms are having 2 rings. Okay, they are having 2 rings, and this is for males. Pick out the odd one. Odd one means which is not matching with the others. Gonorrhea, syphilis, trichomoniasis, all of them are sexual diseases, STDs, sexually transmitted infections, STIs nowadays we call it as, or venereal diseases. So what is the difference? All of them are belong to that category. Then it may be causative agent, gonorrhea, bacteria, syphilis bacteria, trichomoniasis, trichomonas, protozoan, chlamydiasis, chlamydia trachomatis, cankerod, Haemophilus ducrei. So all of these are bacterial diseases, whereas Trichomonas vaginalis is a flagellated protozoan, not a bacterium. So that is why it is an odd one. Avoiding early and proper treatment of STD may lead to which of the following complications? See, early and proper treatment. Suppose we start early treatment, but we will never do it. Why? First is that in early stages, it is causing no problem. It is asymptomatic. It causes no symptom. Second one, because of the social taboo that we are all attaching to this sexual disease, how can I say that I am having an STD to another one? Or go to a doctor and say that I am having this infection in my private parts. So we will be never going. We are all ashamed because of the social taboo attached with that. People will not be going to have consultation with qualified doctors. So because of that, the symptom will be increasing, and only very late, when the symptoms are aggravated, we go to a doctor for consultation. And that too, very often we go to a quack, unqualified doctor who will guarantee that he will treat it and will only complicate the problems. Okay, so never do it. We will be avoiding early and proper treatment. If proper treatment is taken starting very early itself, most of the sexually transmitted diseases are curable. But if we are ignorant of that and we are not taking proper treatment, then it may lead to PIDs, abortions, stillbirths, ectopic pregnancies, infertility, cancer of reproductive tract, etc. These are all the symptoms on later stages of STDs. Initial stages are itching, reddening, discharge, etc. These are all the early symptoms. We normally avoid it, and we will not take any proper medication and will complicate the process. Later on, it may lead to all such problems. Clear? Pick out the incorrect statement. Surgical method prevent gamete transportation. Okay. That is the functioning of surgical methods. Okay. In surgical methods, we are blocking the transportation of gametes. All sexually transmitted diseases are completely curable, except AIDS, viral diseases, genital herpes, and hepatitis. This cannot be cured completely. All others can be completely cured. So, hepatitis, AIDS, and genital herpes. Natural method work on the principle of avoiding chances of ovum and sperm meeting. Again, correct. Barrier method increase the phagocytosis. It is IUD that is increasing the phagocytosis. What is the functioning of or principle of barrier method? They are all barrier, physically preventing the meeting of gametes. Physically prevent the meeting of gametes. Okay, so that is the wrong one. Again, in another form, the causative agents. These are all from our earlier examination questions. Causative organs are human papilloma virus. It is causing genital virus. Haemophilus ducreyi, bacterium, cancroid. That word is not, that name is not in our NCERT books. Neisseria, gonorrhea, none of these names are, the causative agents are not given in our books. Neisseria, gonorrhea, it is causing gonorrhea, treponema pallidum, syphilis. Both gonorrhea and syphilis are called international diseases, very dangerous. International diseases. Okay. And herpes simplex, that cause the herpes, genital herpes. Option including all sexually transmitted disease. Gonorrhea, correct. Malaria is not a sexual disease. AIDS, here also malaria. Here also we are having cancer, which is not a sexually transmitted disease. Gonorrhea, correct. Syphilis, correct. Genital herpes, correct. Herpes, not herpes. Herpes. In which of the following techniques the embryo are transferred to assist the female who cannot conceive? See, we are having a problem with the mother. She cannot conceive. Okay. She may be capable of producing an ovum. So, what should be done? Take her ovum and have it fertilized, but she cannot conceive. Then it should be given to another surrogated mother. Okay. So, transfer to assist the female who cannot conceive. Can he give a gamete? There is no use because she cannot conceive. She cannot become mother because her uterus is not fit for supporting the baby. So, this one cannot be. So, shift. Zygote is transferred into the fallopian tube of a surrogated mother. She needs a surrogated mother, help of a rendered uterus. Okay. And intrauterine transfer. If it is up to 8 cell stage, you can have shift, and if it is up to 32 cell stage, it can be transferred directly into the uterus. Okay. So, that is embryo transfer, ET, because she is not capable of conceiving. Her uterus is not healthy. It cannot support pregnancy. That's why we have to transfer that baby, that fetus, either in a 8 cell stage. If it is 8 cell stage, transfer it to the fallopian tube of the surrogated mother, or to the uterus if it is 32 cell stage. Clear? And ectopic pregnancy. What is ectopic pregnancy? That's a complication of STD. See, from STD, a number of questions are asked. That's a very important thrust area, where the implantation occur in an abnormal situation, abnormal position. Normally, it should be attached to the proper place in the uterus. If it is not in that proper place, then we call it as ectopic pregnancy. So implantation of embryo at a site other than the uterus, normal position in uterus. That is what is called ectopic pregnancies. Okay. A childless couple can be assisted to have a child through technique called gift. Gamete intrafallopian. Okay. So here, what is the condition? We are all giving only a gamete. An ovum is taken from a donor. Why? The mother cannot produce an ovum. So the full form of that technique is gamete intrafallopian transfer. A mother who cannot ovulate should be given an ovum from a donor. That is transferred into the fallopian tube. That is what's called, it is gift, gamete intrafallopian transfer. That is why the option is 3. Which of the following hormone releasing IUD? Hormone releasing IUD. We are having 3 types of IUD. Lipase loop, only non-medicated one. Copper releasing, Cu7, multi-load, etc. That will be releasing small amount of copper ion regularly. And third one is hormone releasing IUD. There are LNG. You correct it as LNG, not LBG. LNG 2011 levonorgestrel. Okay. Levonorgestrel. Cu7, copper 7 and multi-load 375 are all copper releasing, whereas LNG, progestasert, that is to be inserted into the uterus. It is containing progesterone, that is hormone. So hormone containing insert, progestasert and LNG, levonorgestrel 20 are all typical example for hormone releasing IUD. Which of the following is incorrect regarding vasectomy? Vasectomy, vas deferens is cut. It is for males. Okay. So, vas deferens is cut and tied. It is reversible. Surgical methods are also called sterilization method because they will become sterile. They can produce gamete, but gamete transportation is not possible. And that is the most effective type of contraceptive method. Though it is very effective, there is a drawback. That is the greatest drawback. It is reversible. You cannot go back to the normal sexually active or sexually fertile state. That is the greatest drawback. That is why the sterilization method is taken as the last terminal method. It can be accepted only as the last or terminal method. No sperm occur in seminal fluid. See, sperms are not coming. Seminal fluid will be there. Sperms are all produced, but they are not transported. They are all produced and they will be transported up to this level. Since they cannot pass, they will be dead and will be absorbed back. Okay, so the semen will be coming because these are all the seminal fluid. What is semen? Actually, semen is the seminal fluid produced by the axillary glands plus sperm. Seminal fluid is contained in secretions of seminal vesicles, the prostate and bulbourethral gland. These secretions are coming out, but it will not be containing the male gamete sperms. So without sperms, no sperms occur in epididymis. See, it is present in epididymis, but it is not transported through the gametes. That's why no sperm occur in epididymis is the wrong one. This is the epididymis. Okay. They are all produced. Sperms are all produced. They are all transported up this level where their cut is. Because we are blocking the transportation of gamete. That is the technique in sterilization method. Surgical method. Again, same question repeated in different forms. Gonorrhea, we know we are having Neisseria, gonorrhea, bacteria, syphilis, treponema, pallidum, again, genital warts, genital warts are papilloma viruses, AIDS by HIV, human immunodeficiency virus. Okay. Now, function of copper ions. This is a copper T-shaped structure where copper ions are released at the two ends. They are all placed within the uterus by an expert or a doctor. Function of copper ion in copper releasing IUD. What is the function of copper? Copper will be suppressing the motility of the sperms. They affect the flagellar movements. They will suppress the movements, flagellar movements, tail of the sperms, thereby suppressing the effectiveness, suppressing the fertilizing capacity. They suppress the sperm motility and fertilizing capacity of the sperm. That is the action of copper ion. Correct. They inhibit gametogenesis. No. It is never inhibiting, suppressing the gametogenesis. They make uterus unsuitable for implantation. That is hormone releasing IUD. They inhibit ovulation. Inhibit ovulation is the function of pills, oral pills. Cause of couple where male is having a very low sperm count. Which technique will be? See, sperm count low, oligospermia. That condition is called oligospermia. Intrauterine transfer. See, this IUT is for transfer of embryo after in vitro fertilization. That will be usually for defects in female who cannot have ovum or who cannot conceive properly. Gamete intracytoplasmic fallopian transfer. See, gamete intracytoplasmic fallopian transfer. It is intracytoplasmic transfer of or injection of sperm or transfer of embryo to the fallopian tube. It is not at all correct. It is artificial insemination. See, artificial insemination is a technique when we are all taking the sperm from a donor, and because he cannot produce viable sperms, sperm count is very low. So, in case where the male is having very low sperm count, we can take the sperm from a donor, artificial insemination, and intracytoplasmic sperm injection when the sperm is having no motility. Here, the problem is that there is no sperm, low sperm count. So, we have to take it from a donor. So, it is artificial insemination. AI, it is called artificial insemination. Then, what is Saheli? Saheli is a pill, weekly once. We can take it only once. Need take only once in a week. It is an IUD? No. It is a pill. Increase the concentration of estrogen and prevent ovulation? No. It is not at all interfering. Saheli is a drug developed by the National Drug Research Institute, Lucknow. It is a non-steroid, non-hormonal oral pill that contains Sencromen. That chemical is Sencromen. That was asked for the last year. Sencromen. What is its action? It is an anti-implant. It prevents implantation because it will be blocking estrogen receptors in the uterus, so that estrogen will be having no effect. And since estrogen is responsible for the proliferation, since the uterus is not sensitive to estrogen, no proliferation will be occurring and no endometrium proliferation had happened. Uterus is not producing any bed-like structure. So, fertilization, after fertilization, the embryo cannot come and get implanted because the uterus has not undergone proliferation. Block estrogen receptors in the uterus, thereby preventing egg from getting implanted. That's why I told you it is an anti-implant agent. That is the correct action. Sencromen is not at all a hormone, so there will be no side effect. It will not be affecting the menstrual cycle because it is not at all a hormone. It is not at all a steroid. So no side effects will be there. That's why Sahel is widely accepted. Okay. It's a post-coital contraceptive. Post-coital contraceptive is morning after pill, emergency pill or E-pill, emergency pill, which is also called morning after pill. After coitus, emergency, within 72 hours, we have to give a hormone containing pill. That's called E-pill. Okay. Select the hormone releasing IUD. Hormone releasing IUD. Multi-load. Multi-load is a copper. At several points, copper ion will be released. Okay. Progestastat. Progestastat is a correct one. But multi-load is not a correct answer. It is a copper ion releasing. Progestastat and LLG20, correct. Both of them are hormone releasing. Lipase loop, it's a non-medicated IUD. Walls is a barrier. Okay, so correct one is 2. Which of the following sexually transmitted disease is not completely curable? In our book, it is given AIDS, hepatitis B, and genital herpes. Okay, they are not completely curable. Okay, genital herpes. Genital warts, chlamydia, gonorrhea, they can be treated. Whereas genital herpes is not curable. It is given in our book clearly. And the last question from this chapter, which of the following contraceptive methods do involve a role of hormone? In barrier method, there is no hormone, but lactational amenorrhea, the milk is containing an inhibiting factor that suppresses the anterior pituitary in producing FSH. That is the action. That's why no follicles are developing, no menstruation is there. Okay. So this is having a hormonal action, but barrier method is not containing a hormonal action. Copper tea is not at all containing a hormonal action. Pills, what type of pill? Whatever may be, the pills are oral pills. They are always containing hormones. Emergency contraceptives, E-pills. Barrier method. Again, barrier methods are having no hormones. Okay. Lactational amenorrhea. Milk has an inhibiting factor that suppresses the release of FSH by the anterior pituitary. So there is a role of hormone in that. Okay. Lactational amenorrhea has a hormonal role. Pills. Pills are having either estrogen or progesterone estrogen combination, correct. They are all having hormones. And emergency contraceptives, which is called E-pills, emergency pills or morning after pills, they are all containing hormones. So that is the correct combination. Clear? So with that, we have completed the most important probable question from the chapter reproductive health. Clear? The second chapter from our second year topic. Hope it has helped you a lot in understanding the concepts, and I am winding up my session and will be meeting you with another set of questions from another chapter. Until then, goodbye and see you. Thank you all. Thank you very much.